Whenever I speak at conferences and stuff, I always include something about implicit bias. Most of my case bases, are about women of color because I want that to be part of the equation. I don't, ACOG came out with a statement this month about women when it comes to, speaking specifically about OB maternal death and how it's 3 times higher in women and Black women. And that we used to say race is a risk factor, but we have to call it what it is. Anti-Black racism or, anti-brown racism is the issue, right? This is the issue we're dealing with. We're trying, and most of us, we carry implicit bias and we don't realize it, right? So I have to point that out specifically, that this is not just because it's not putting the onus on the patient. You're brown and this is why it's happening to you. No, it's the system. Our system is broken and this is why it's happening to you. That we are trained to, I was talking to 3 of my fellow OBGYNs that are also brown and Muslim or brown and Hindu or whatever. And they said, do you remember, were you a resident when they told you, hey, there's another brown patient in the room that won't let you examine her because she has vaginismus. Why don't you take care of it? And every single one of us had a story from our residency where we were like, yeah, they were like, what's the deal with your brown patients? What's the deal with that Indian lady? What's the deal with that Pakistani lady? Why is it that she won't let you examine her? And this is coming from an attending, right? These are usually like attendings, some of them, men, some of them women. And you're like, this is what you're telling me. I'm learning this. And that some of us were like scared interns for the first time, didn't know how to respond to that. But that's implicit bias, right? That's ingrained in them. They see a brown lady that can't have an exam and boom, this is your culture problem. Yeah. No, it's your problem. It's your racism problem. You got to call it what it is. Yeah. Like this is racism at its finest. And so I think that, in your own way, we have to be able to say like, and I have patients, I don't deliver babies anymore, who I get pregnant, and some of my Black patients, they cry when they leave because they're like, how am I going to make sure someone listens to me? And I'm like, you call them out if you have to. Like, we have to talk about it, what it is. Like, this is something ingrained in our system. It dates back to colonialism, to slavery, to all that stuff. And it's just continued. And so this is something we have to make sure that, patients understand that this is not your problem. This is not a yes, exactly. So that when it comes to clinicians, I'd like to say that like we should really keep our mind open and, open-ended questions. Let a patient tell their story. Don't interrupt them and say, oh, because you're Black or brown or this or that, like this is why. No, you let them tell their story and you listen to them and you check your bias at the door if you can. We all have it. It's shown across the board. So we have to do that, number one, from clinicians. From a patient perspective, of course, if you're, like you feel shameful to bring it up, or, like I sometimes when people ask me, I'm always like, do you think I'm brave or do you think I'm shameless? Because like, am I brave to talk about these issues as a brown Muslim woman, or am I shameless? It could probably go both ways depending on who's interpreting it. But you also have to understand that, men will come and they'll get their Viagra and they'll get taken care of very easily. But who's having potential intercourse with these people? We have to address the women as well. That's how ISHWA started as a foundation. Like, the men were getting their Viagra to Dr. Irwin Goldstein. What about the women? We have to own our own health. We have to be our own health advocate. And we have to we have to kind of even overcome the shame that we may feel. I used to feel shame too, like, oh my God, I'm a gynecologist and but it's like, at some point you have to realize this is my body. I deserve better. I need better. We're managing the world on our shoulders as midlife women, right? We have parents, we have kids, we have work, we have everything. And so we have to say, like, if I don't take care of myself and take ownership of what's happening to me, then, I'm doing myself a disservice and everyone that depends on me. And so that's what I tell my patients who are kind of like hesitant to talk to me. Most of the time, I think, I give them such an open forum that eventually they will just, but I think that, you have to really say like, you know what, this is okay. This happens to almost every patient that goes through this. You are not alone. You are not broken. This is okay. And you need to just tell us about what's happening.